Low-income families are facing greater obstacles in accessing medical care. We follow two patients as they navigate their health challenges.
There is a shocking new statistic about what causes most personal bankruptcies in this nation. It has nothing to do with the stock market or job losses. Instead, medical bills are the reason nearly 2/3 of the time.
Care costs are about to go up. A new report suggests it could be the largest jump in a decade.
Depending on what type of insurance you have, it could rise 5, 10, even 20%.
In Appalachia, where poverty is entrenched, access to healthcare often relies on nonprofits. Across these 13 mountain states, free clinics and volunteers provide a vital lifeline. Teresa Tyson and her Health Wagon, in partnership with the Virginia Dental Association, are setting up their annual health fair, bringing $2 million in free medical and dental care to rural communities. Over 3 days, thousands will drive from hundreds of miles away for free treatment.
Times have traditionally been very hard here in the central Appalachian, all up and down the Appalachian region. It's like I've, forgotten the success of this nation was born on the backs of the coal miners here. And it's just like, so many times I feel that they've just been forgotten. They are a population, it's certainly been disadvantaged over the year, but maybe one day we wouldn't have to have like the event like they were getting ready to experience this weekend, where people have to come up and they have to line up for health care. I'd like to see one day when that certainly doesn't have to be anymore. The individuals will park up here. They will come in. The dental will go to the right. To the left will be our medical and the vision. So when they enter there, they will go into the red grandstands in here, and it will be a holding area. We want to screen everybody for Medicaid. We've expanded Medicaid in the state of Virginia. A lot of people don't know they're eligible for it, so we want to get them in for insurance. And the reason that's so important is because, one trip to the hospital or one catastrophic event can bankrupt these individuals. Here in the United States, I think that we have a wonderful healthcare system in certain regards. So maybe if you have a catastrophic occurrence in your life, say maybe you're in a car wreck or something like that, that you need to be, in ICU, we've got, that is wonderful. But I don't think it's so much on, like the prevention and, just primary care. We're going to make a lot of difference in a lot of people's lives. And I really feel that it's because of this event that we're changing that trajectory of negative healthcare disparities here in Southwest Virginia, because it's all these wonderful, wonderful volunteers, everybody, working from the heart. So that's what the Health Wagon is all about.
In the U.S., health insurance is mostly tied to employment and ends when the job does. As healthcare shifted towards profit, a divide emerged: private insurance for those who can afford it, and government programs for the poor and the elderly. But many in the middle class are left behind. 1 in 4 cancer patients now declares bankruptcy or sells their home to cover the treatment costs.
I'm originally from New York. I was born and raised there. So I moved here. I've been in Baltimore for like 25 years now. I started working at my company back in the early 2000s. We did mortgages then, and then everything happened with the mortgage market in 2008. Then we switched over to real estate. And then in 2023, out of nowhere, I was diagnosed with this advanced aggressive cancer, which was just shocking. And it was just, totally out of nowhere. We're going to the cancer support group, Baltimore Cancer Support Group over in Baltimore County. I started going when my mom was sick back in either 2012 or 2013. Then I just stayed part of the group. Normally we just will go around the table and everybody will catch everybody up kind of on their week and what happened, and if you've got news about treatment or whatever it is.
I found these on Amazon, so the icebreaker, and every week somebody different's gonna pick one. It's just nice because it kind of breaks the ice a little bit. We get to know everybody's name, your groups. So tonight was Steve, and that's why it was a terrible question. I mean, 170 questions, and he picked up, do you want to know when you're going to die? I mean, you know, needless to say, he'll never get a chance to pick one again.
I would like to know, because I wait till the last minute.
Yes, I would like to know, maybe to, you know, like say goodbye for some friends and family members.
And I would not like to know. I just go forward, just live.
I really don't think I'll want to know, but you know what? Is there a negotiation? Like, can you just be tipped off that it's going to happen soon?
I wouldn't want to know. I don't want to know my mortality with the cancer. And, that feels like enough mortality itself that, like, no, I wouldn't want to know. I would spend every day like anxious counting down until the end. It would be awful. No. It's a great group. It's great just to know that people are going through what you're going through, that people understand it. It's a good place to get like resources of like different doctors in the area or different, like I've been able to tell people like different financial, charities and stuff that you can get help from and things like that.
If I can remember correctly, the oral chemo drugs, which came from a specialty pharmacy in Florida, was, I think, $30,000 a month. And when they told me how much it was, I said, well, I need the meds. I certainly don't have $30,000. I was able to, through the social worker at the hospital, I was able to get a grant that covered the $30,000 figure, but $30,000.
And they actually have a program, and as long as you qualify, you can't have a lot of money.
Yeah.
As long as you're a little bit below middle class, you can get help. But if you make money, you're screwed. They're not going to help you. They want you to sell everything you have, and that's why I had to retire. Now medicine is, insurance dictates. Your insurance company will determine if you get treated or if you don't. Medicine in this country is broken. If you have no insurance, you can apply for it to help pay for all your care. If you have insurance, they will not help you. But you have to have zero insurance. So for you, you could not get help through this.
Unfortunately, I'm very fresh with my brother just passing away.
I met my husband, my late husband, through the cancer support group. He came for himself. He had colon cancer, and we met and dated and fell in love. We got engaged in 2015, and we're planning an October 2016 wedding, when in the summer 2016 he took a turn for the worse. So we did a quick, we did a courthouse wedding, but then we threw just like a big, like, kind of wedding cookout in our backyard and had everyone come from all over the place, and it was beautiful. Everyone from the support group came. It wasn't the wedding we were planning, but it was still a gorgeous wedding, and he hung on for that day. He died 5 days later in our house right next to me.
Laboratory services. Again, this is all lab down here. Holy, I never even saw that. Oh my God. $22,000 for one treatment of proton therapy. For just one treatment, and I need 15.
I would say overall, I probably have about $100,000 in debt. I decided early on, though, that I didn't care what the cost of things were, that I was going to get whatever treatment I needed to get, whatever was the best treatment they recommended, regardless of the price, because you can't ruin a dead person's credit. And so if I'm dead and I paid all these bills, it's great, who cares? But if I'm alive, at least I'm alive with debt, you know? So I decided then that, like, the thing with the surgery, the cost and everything, I was like, just whatever it is, you know? We're just gonna do it and deal with the aftermath afterwards.
Good afternoon. How can I help you?
Hi, yes. My name is Amanda Widrow. I have an issue going on where they're saying they're not covering a service that I previously had covered.
Okay. So reason I'm asking you to reach the sales department, but let me get you with member services so they can check on coverage for you.
Okay, thank you.
Thank you for calling. How can I help you today?
Hi, yes, my name is Amanda Woodrow, and I have a current policy with you guys. There's a service that I've been receiving, and the medical office is telling me that you guys are no longer covering the charge.
Let me get you connected to the right line. You did end up in the large group employer line, but let me get you connected, okay?
Okay, thank you.
Yeah, of course. So you're going to hear some music for a couple minutes. I'll comfort you over there.
Thank you. Yeah. If it's not cold, it's another thing.
Good afternoon. How may I assist you?
Yeah, I was giving you a call because I have a current policy there. I've been a policyholder for like 10 years now, and you've always covered my nutritionist, and I'm being told now that you guys are rejecting claims from them.
Okay. So let me actually get you over to the department that handles your plan.
I thought that was you. They transferred me from the last department to you, no?
No.
Yeah. This is my third transfer. This will be the right department?
Okay, yes.
I'm probably the best insured you can be, like one of the best insured you can be, and it still is underinsured, even though like technically it's not somebody like, I do have a $1,700 deductible, but there are people with $5,000 deductible. So yeah, there's still money that always has to be paid out of pocket. My husband, when he was going through it, he worked for the government, the federal government, the USDA. He had good insurance through them. He did not pick the lowest plan. He had to pay $10,000 every year before he got 1 penny of treatment once he had cancer. I don't even mind if my taxes go up a little bit to pay for other people. Like, I'd rather they're getting their treatment than to know somebody's dying of cancer because they literally just can't afford it. So yeah, I would definitely say universal health care is what we need. We need everybody in this country to be covered for all major events. I think it's definitely the pharmaceutical companies driving up the costs and the medical companies and just the way everything, I mean, I don't know the intricacies of it, but I know it shouldn't be this expensive. It shouldn't be.